guys, thank you so much for coming today. My name is Katie Bear. I'm currently a staff nurse over at the EC, and I am working on my master's in nursing education. I have partnered with Lauren Ivanhoe to bring you guys some great education on EasyVest. So I have a couple questions. I know that you are probably wondering, why am I here today? And we're wondering why we're here for our patients. So I'm going to answer the first question for you. Why you're here today is because we have talked to your leadership team, and there's definitely some need for training on this device. I know typically before 3 West got most of these hip spica, brachial plexus patients, but now we are increasing our census over at 5 West. I talked to a couple of your nurses. Some of them have said, yes, I've seen it. Some of them, I've never seen that in my life. So we're here to kind of get everybody on the same page so that as census increases, especially during wintertime, everyone is prepared, and if you get this kind of patient, you're going to know how to treat it. And I talked to some of the other nurses, and I know on night shift it was definitely a big concern because they were thinking, hey, I'm never going to see this kind of patient. I don't really need to be trained on it. I'm not going to get them because they're going to be discharged during the day, which is probably true, right? You're not going to go down and strap this patient in at 3 o'clock in the morning into their car and send them home. However, one of the biggest things I want to talk to you guys about today is anticipatory guidance, right? We want to teach our families things before they encounter them. So when they start seeing this contraption, they don't get all freaked out. We've already kind of given them a little bit of a heads up of what they're going to anticipate. In addition, we just really want you guys to be able to provide safe and effective care for our patients. So that's why we're here. My question for you guys is, why do you think that this is important? And what do you think are the barriers for these families when you're teaching them?
Well, I'm thinking if I'm a parent and I see this jumpsuit looking thing, I'm concerned about my child's safety, right? I went to a parenting class when I had a child, and I was told they must be rear facing in a car seat until they're like 40 pounds or something, and now you're giving me this jumpsuit looking strap. Is my child going to be safe? That's what I would be concerned about as a parent.
Yes, and that's absolutely one of our biggest concerns, right? We think that parents who go home with a healthy newborn baby, we go through really intense teaching, like make sure you strap your baby in correctly, for a kid who has no problems whatsoever and is not in a cast on both sides of their legs. So we need to be really cognizant of the fact that this is new for families, that this is really hard, and this is what they do, right? They're going to transport them from the hospital to the grocery store. Everywhere they need to go, we want to make sure that they are able to do that safely. In addition, it's our job as nurses to make sure that these families feel educated and empowered to be able to do that. So those are the biggest reasons why we're here today. So the next step is to talk about what it is. What are we going to do, and what are our policies and procedures around it? So we have little baby Lucy here today. So little Lucy is in a double hip spica cast. So some of our patients will have 2, some of our patients will have 1. Just kind of depends on their medical problems. But we have to decide, is she going to go into a car seat or is she going to go into an EasyVest? So our qualifications based on TCH policy will be that the baby needs to be over 2 years old and over 20 pounds. So if we have an 18-month-old that weighs 24 pounds, they do not meet the requirements for an Easy On vest. However, we do have solutions for them, so we can call our physical therapy team. They are going to be our biggest counterparts in this. They do need to have an order, so we need to make sure we have our physicians put in that order saying we need a consult for a hip spica car seat, and they can come up and teach the families. This has to be done prior to discharge. These families with brachial plexus injuries and hip spica casts cannot go home unless they have been educated by the PT team in regards to the car seat. Now, there are 2 different types of Easy On vests, or 2 different sizes. The first one is typically for 2 to 5-year-olds, and that is going to be for kiddos who weigh about 20 to 65 pounds. And then the next size up is going to be from 5 to 12-year-olds, and that's 20 to 100 pounds for them. So we want to make sure that they are able to do it. We can size them appropriately, and even if a kiddo is 55 pounds and we put them in this, if it doesn't fit them correctly, we need to call PT and figure out what our other options are for this family to make sure that it fits snugly. In addition, I think those are our biggest points for the policy. And now we're just going to go over how to press or to put the baby into the EasyVest. So we're going to pick up our little Lucy after we have the EasyVest completely laid out flat for the families. So we'll pick her up by her head and her bottom, and we'll set her right in. And we want to make sure that there's this little parachute symbol on the EasyVest that's always going to be facing up. You never want it facing down. That's going to help you get her all settled in her car. There are 2 chest straps that go right over the top We're just gonna snap them in. As you can tell, little Lucy would not quite meet our requirements, but for training purposes, she does a good job. So you're gonna want this to be pretty snug on her. You're gonna pull these these straps pretty tight, just like so. And then you're gonna do our shoulder straps next. This is a bar slide strap. So you're gonna slide them up and through. And then we're gonna slide it back through, and this is gonna lock it. Underneath here, you should have 1 to 2 widths of your finger. We can't quite get that with little Lucy, but for your patient, if it fits properly, that's how it should work. And you're gonna do it on the other side. And the biggest teaching points on the shoulders is to make sure that the families go back through with this second locking section of it. The next section is gonna be your leg straps. These are a little bit more user-friendly. They just snap right in. And just like the other ones, you can take this in piece and it will go right through here, the little section, and that's gonna lock it. And now little Lucy has her Easy Vest on. And there is one more piece that looks just like a seatbelt. This is your leg strap. If Lucy had just this one leg casted, you would put the strap right around her ankle, or right around her leg, excuse me, and you would tighten it, and then it goes right below her knee. Since Lucy has both straps, we are gonna go just like so, and you're gonna tighten it, and they go right below her knee as well. This is gonna make sure Lucy is secure and all tight in her little vest. So the next step is what? She's all settled. We are going to teach the family.
Yeah, we gotta make sure the family can do this.
Right, so we need to make sure the family right before they get to the car. So some things that we want you guys to do is maybe even the night before or 2 nights before say, okay, our next step in 2 days is you're going to be going to home. So I have created this little QR code that has a video. You can scan it on your phone or the family's phone or the tablet, and it's going to bring you to a 6-minute video. And it shows you exactly how to put this on and exactly how to get the baby in the car. This would be a really great resource for your families. So you can say, okay, go ahead and watch this video. Tomorrow we'll actually look at the piece of equipment so that they have an idea, okay, this is what I'm going to see tomorrow and this is what I'm going to need to do.
How can I get that QR code?
So I'm going to be placing this QR code. There's some patient education folders that we'll have at your nurse's station. In addition, in the Omnicell on that bottom shelf where they're located, I'm going to have that QR code posted right there. So as you pull it out and they have their pamphlet in there, you're going to be able to scan it and it'll pop right up on your phone so that you're able to see it.
Very cool.
So that'll be great. So once families say, okay, I feel comfortable, we're ready to go home, we're going to take baby to the car. I feel like this goes without saying, but we should probably address it. Families do not need to pick up baby by the straps or like this or hang her up and down. We're gonna pick her up by her head and pick her right underneath her bottom. This is our simulated car bench. One of the other things we need to discuss with the families with the anticipatory guidance is they have to have a car that has a bench seat. There can be no other kids, aunts, grandmas, dogs in the bench seat, just the baby. Right. If their car does not have a bench seat in it, that's one of the things we need to do is we need to discuss, okay, what resources can we mobilize for you? Do you have an aunt, an uncle, a friend who's got a car with a bench seat that's going to be able to bring it in for you? So once we get the baby and they say, okay, we're good to go, here I am in my bench seat, we're going to strap our baby in. So we have our first seat belt here. It is going to go through this top chest strap. If our baby has one leg that is has a cast on it instead of both, we're going to make sure that this leg is closest to the back seat of the car. And it's also important to make sure that the baby's head is always in the middle of the car. So you never want baby's head right next to the door just for extra safety purposes. The second strap you're going to take goes right underneath the leg strap that we put in that second chest strap. Like so. And then baby is all set up in the car. You want to make sure, our seatbelts don't quite do it, but you know when you pull out your car seatbelt and it makes that little clicking noise, you want to make sure that it goes back all the way so that it's locked, so that the car seat or the seatbelts don't move at all while the baby is placed in. In addition, if your kid is maybe bigger and their legs are just sticking straight up in the air without support, it is okay to put some pillows underneath the legs and underneath the head. However, you don't want to place any pillows underneath the body so that it doesn't mess up how your straps are laid. Furthermore, you can put a couple pillows in the very bottom of the floorboard of the car in front of you if you feel that would be necessary in case something unfortunate would happen. It would give that baby a little bit extra cushion if something unfortunate were to happen. And then I think those are the basics. Do you guys have any questions at all about how to apply the vest or any of our policies regarding the vest?
So can a tech or one of our PCAs, can they do this with the family?
That is an excellent question, Lauren. They can help carry the baby. Like if we're trying to shift the baby up into the car, they are able to help assist you in lifting. However, they cannot educate the families and they cannot strap the baby. And they can provide some manual support, but they are not able to do any of the teaching or any of the actual application or fastening of the vest. Thank you for that question.
So does the 20 pounds include the cast?
Yes, that's also another great question. It is all your casted weight. So baby comes in, weighs 14 pounds when she's here, and then we put the cast on her and she weighs 25 pounds. That is the pounds that matter, not the 14 pounds when she first got in here. Yeah, great. So any other questions?
What about you mentioned you have to bring the strap back around to lock.
Yes, ma'am.
Is that has to happen every time, or that's an
Absolutely.
extra option?
No, not an extra option. That is a necessity because that makes sure that our straps don't move about. So when mom and dad are driving in the car, baby's not able to slide up and down in the car. So this just provides an extra layer to make sure that those straps don't go anywhere.
So what if that I guess the buckle that's
This one?
Mm-hmm. What if they lose it because it's not attached to the rest? Is it separate, right?
Yes, it is a separate piece. They can either contact the hospital and we'll go ahead and try and mobilize those resources for them, as well as we can contact the manufacturer. Okay? If you don't have any other questions, we'll have each of you guys come up and you'll demonstrate what we've done to make sure that you are able to teach the families, and you'll pretend like I'm your family and we'll go through that. And I'll check you off on your competency if you'll be able to do that, and then I have an evaluation for you to fill out for me and about the content as well. All right, thank you guys so much. I appreciate it.
Thanks.